Hello everyone, welcome back to Braces and Bones. Today I want to discuss with you a very common dental problem or a dental finding. That's a midline diastema, gap between your upper front teeth. If gap between your upper front teeth is something that bothers you or is stopping you from smiling, the next 5 minutes will help you decide what treatment to go for. I'll be discussing 3 treatment options with you, namely the quick fix, that's a composite buildup of the tooth. The second one is dental veneers, and the third one is orthodontic treatment, that is braces and aligners. So let's jump into the 3 options. Firstly, composite buildup. I like to call it the quick fix for midline diastema. This procedure basically involves adding a tooth colored cement, that's a composite cement, between your front teeth, which will help closing the gap. If done properly, this composite cement does stay in place for years. But a small catch here is that this cement might discolor over the period of years. When we talk about the treatment time, it usually takes 1 to 1.5 hours for your dentist to recreate a smile for you by filling these gaps with composite, giving you a very natural looking smile. But composite buildup does come with its own demerits. Firstly, because we are adding a material in between your teeth, the size of your tooth is going to change. That is, adding a material means the tooth size is going to look a little bigger than its original natural size. And number 2, the precaution that you have to follow for a lifetime with composite buildup is that there is a restriction of biting from your front teeth. That's you're not supposed to bite anything this way, not supposed to cut your food this way from the front teeth. You're supposed to chew your food from your back teeth only. Coming to the second treatment option, that is dental veneers. I'll be explaining to you the procedure of dental veneers in brief. Firstly, mild reshaping of your tooth is done. Now, after this reshaping is done, measurements in the form of either scans or impressions are taken and they are sent to the lab. Based on these measurements, we receive a very thin shell of tooth colored material. That is a very, very thin shell, somewhere around 0.8 millimeters of tooth shell comes to us from the laboratory that's made specially for your measurements. This shell is then glued to your teeth. This helps in closing the gap. Coming to the time frame, it usually takes around 3 to 5 appointments at your dentist's office and somewhere around 7 to 15 days for you to get a final desired smile. Now, the biggest benefits of dental veneers over composite cements is number 1, you can eat as much as you like from your front teeth as you used to before getting a dental procedure done. And the second one, if desired, you can ask for change of tooth shape, size, as well as shade of your tooth if you are not happy with the current shade or current color of the tooth. Dental veneers might be contraindicated in 2 cases. Firstly, if you already have existing sensitivity of the tooth, dental veneers might not be the best option for you. And secondly, if the gap between the teeth is really big, that means it's going to take a lot of material to close this gap. So you might end up having an unnatural smile at the end of the veneer procedure. The last and the final treatment option for diastema closure is orthodontic treatment, that is closure of these spaces with braces or aligners. Orthodontic treatment involves controlled movement of these teeth towards each other to close this space. The benefits here are that orthodontic treatment is the most natural way of closing these spaces. Having said that it's the most natural way, it of course is the most stable and long-term treatment option that can be offered to you by your dentist. Also, because this treatment does not involve adding any material or reshaping of the tooth, that means the chances of sensitivity or not biting from the front teeth, they are both eliminated. But of course, this treatment also has its demerits, namely long treatment duration. So, to get you a stable result, Treatment time can vary from anywhere between 6 months to 1.5 years, depending on how big your gap is. And secondly, you have to go for frequent dental appointments. That is, you have to go for your appointments once at least every month or once in 2 months. So, I've discussed in detail with you about all the three procedures, their benefits, and their demerits. It's your time to take a call as to which treatment option suits you the best.